Hello. I see that you are here today because you have the flu. I'm so sorry to hear that. Well, I'm going to take care of you over the next few minutes, okay? So just relax as much as you can, and we will get you starting to feel better as quickly as possible. So just tell me your first name, please. Okay. It's so nice to meet you. And how long have you been having flu-like symptoms? Okay. And what's your date of birth? Okay. I'm just going to read off a list of symptoms, and I need you to just tell me if you've been experiencing them, okay? Okay, so coughing, sore throat, a little bit, headache, fever, runny nose, stuffy nose, body aches, fatigue, vomiting. Okay. And any past medical history concerns at the moment? Okay. What about major surgeries? And has anyone else around you been sick? A roommate, spouse, family member? Okay. Any allergies to medication? Okay. And have you been taking any medication for your symptoms? Okay, and how often? Okay. Perfect. So I'm now going to start with the brief checkup to see what's going on, and then get you some medications to help you feel a little bit better. So let me just grab my supplies and then we'll get started. Okay, are you still feeling okay? The best you can, right? Well, let's get started. So the first thing is just taking your temperature. I am thinking you have a slight fever. So let's just check. And I'm just going to need you to put this under your tongue, okay? So, there you go. Just leave it there for a minute. So you do have a slight temperature. It looks to be 102. So we'll definitely have you start taking some ibuprofen to control that. So now I'm going to just take your blood pressure. Have you had this done before? Okay. So it's pretty simple. Let me just put my stethoscope on. Okay. And I'm going to need your right arm, please. And I'm just going to stick my stethoscope right here. Alright, now just stay still for me. And continue breathing as usual. Very good. Just stay still. over 80. Blood pressure. Okay. So now I'm just going to listen to your heart. So deep breath for me. And another one. Very good. Okay, now on your back. Deep breath. And another one. And then one more. Okay. Very, very good. So no concerns with your heart or your lungs, which is good. So, normal heartbeat. And no lung issues. Next, I just need you to put out your hand for me, and I just want to check your pulse. Very good. Okay. And just hold for a few moments for me. Okay. Very good. Just keep breathing. Very good. Okay. Perfect. You can relax. And that is normal as well. Now let's take a look at that throat. I know you said you don't feel like you have a sore throat, but I'd like to look anyways. So I'm going to need you to open your mouth wide for me. I just need to see all areas of your throat. So can you look up for me? Very good. And lift your tongue. So your gums look normal, however, your throat is definitely a little bit red. Nothing too concerning, but if it starts to hurt worse, you'll definitely want to follow up with us. You just want to make sure you don't develop strep throat. And do you mind if I just feel your neck and the sides of your face for a moment? Okay. Just stay still. And does this hurt? Okay, good. Definitely feel some tenderness. And I can tell you are a bit swelled as well. So we'll definitely need to give you something for that. Okay. And that just hurts a little bit. Okay. Now this might sound silly, but next I'd like to just briefly take a look at your eyes, make sure everything seems normal there as well. So, let me just find my light again. Here we go. So just follow the light for me. I'm going to just put it in a simple H formation. and just follow with your eyes. So you want to keep looking straight ahead at me and just move your eyes. Okay? Alright, so let's begin. So just follow the light. Okay. Very good. Very good. And I'm going to move this close to you, so I just need you to follow it as well, okay? So I'm going to start back here. Just keep looking at it as it moves closer. Okay. Very good. So, let's see. Next I'll have you just look at the eye chart. Just to make sure. So, can you read the lowest line for me right here? Very good. Can you cover your right eye and read it again? Good. Now cover your left eye and read it one more time. Perfect. Okay. So that is all good. So I'm going to ask you to cover your left eye with your left hand. And I'm going to ask you to directly look at my left eye. And while you do that, I'll be holding up some fingers, and I need you to just tell me how many I'm holding up. Okay? So, let's get started. Very good. 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 Now we're going to reverse it. I need you to cover your right eye with your right hand and look directly at my right eye. Okay? And I'm just going to hold up fingers again and tell me how many there are. Okay? So, good, 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 good. Okay. So I'm just finishing up my notes here to make sure I have everything I need. And then I'm just going to double check with the doctor to make sure he agrees with the overall plan. But I think I have the items in mind that will be very helpful for your recovery. And obviously it does seem like you do have the flu based on your fatigue, your body aches, your lack of appetite. You have only vomited once, which may have just been from something you ate. It's not always common, but sometimes it happens with the flu. And obviously your high fever as well. So we're going to just take care of all of those things for you. So let me share this with the doctor, and I will be back in a moment. Okay. So the doctor agreed with my plan of attack for your flu. So let's go over everything. So I made this little pack for you to take with you. and it has some of the items that will help you feel better, and then a few of the other things you should hopefully already have at home. So first of all, I know you have some congestion, so I have this nasal spray. I would only recommend using it maybe once, twice a day max. But if you need it, I'm going to give this to you. I also included some cough drops in case you need them. I know you don't have a super sore throat right now, but if you need them in the future, they'll definitely help. And then I did give you a decongestion pill right here. So I want you to take this during the day, every 6 hours, and this will definitely help you be able to breathe. So I give you a few of these, and if you need more, you can just pick them up at the pharmacy. I didn't have any nighttime decongestant, but again, you can pick that up at the pharmacy. That will definitely help you have your airways cleared when you're sleeping. So I would do that. And maybe also sleep with a high pillow under your head. The elevation will help kind of drain out your nose. And are you taking vitamins every day? Okay. So you want to make sure you continue with the multivitamin. And do you have zinc at home? Okay. I would recommend zinc as well, at least a few times a week. And then vitamin C, which I'm going to give you right here. Now, I would say you should have some smoothies if you can stomach them. Vitamin C straight from the source is the best way to get it. But this is a spray that I would recommend. And let's see, this is an organic whole food vitamin C spray. And you just do 5 sprays per day. So do that as well. And that will help you get some good vitamin C to help you get better faster. And then of course, you don't want to forget to have good chicken broth, any kind of broth really, to help you feel nourished. And I know you're having a little bit of trouble stomaching heavier meals, which is expected. So you can just have some toast with maybe peanut butter for protein, or some crackers with peanut butter. Really anything you can stomach right now until you get better. And I would definitely recommend lots and lots of water. So make sure there's water by you at all times. Make sure you're always drinking. You need to be hydrated, and that will help you feel better faster. And I almost forgot ibuprofen. So you'll want to be taking that every 4 hours to help with your fever. Okay? We want to get your fever down and keep it down. So start off with that. And then I'm going to check in with you tomorrow to see how you're doing. So I think that's everything. Besides the main thing, which is sleep. I want you to try to just rest and sleep as much as you can. So it's the perfect time to watch movies, TV, and do not go to work until you feel better. Okay? And do you need a doctor note for work? Okay, I can write that up for you. No problem. So, how does that all sound? Good. Well, I do hope you feel better soon. And I sent not only your doctor note to the front desk, but I also sent in another prescription if you were to run out of any of the items that I gave you, okay? So I want to follow up tomorrow with you. So feel free to answer the call when I check in the afternoon, but if you're sleeping or resting, that's okay. I just want to make sure nothing is getting worse, okay? And you can also send me an email too as well if you'd like. Just want to make sure you're not getting any worse. So follow the plan that I outlined for you. And again, make sure you get lots of rest, okay? So thank you for choosing me as your nurse today, and feel better soon.